In managing primary disc-related disorders, there's going to be the condition where we can go with a patient from 3D axial separation and extension back to their exercise and recovery. If a patient was started out in 3D axial separation and flexion, we attempt to progress them into a 3D axial separation and extension because the extended position is more functional. In either case, there are those cases where they get better, but they don't get well, and they need a little extra treatment to attempt to get them past that final hump to recovery. In this case, we may elect to use our leg over 3D axial separation technique. In this technique, I'll be standing to the side opposite to the side I'm treating. In this case, I'll be treating her right side. What I'm going to do is bring her right hip and knee up to 90 degrees of flexion. In this position, I then will lift, give axial traction on her right femur to lift her right buttock off the mat. And in so doing, I'm going to be providing a right rotation to her lumbar spine. In that position, I'm then going to transition her leg to 45 degrees of hip flexion, reach across while maintaining traction on her right leg. I'll switch my hand around so I can apply more traction. I'm not putting a lot of weight on her right shoulder. I'm simply supporting her. I'm cradling her leg between my leg and my hand. I can either provide a long axis traction to her leg, increasing her left side bending and right rotation and extension. I can also emphasize rotation from this position, whereby then I push her leg down towards the floor, emphasizing the rotation. In either case, I can add a high velocity thrust technique. I can add it in the direction of side bending or side bending separation, where I give a thrust in the long axis direction of her leg. I ask her to take in a breath, let it out again. At the end of her breath, I give a thrust. I don't let off quickly, but rather let off slowly. Or I can take up the slack in the side bending, ask her to take in a deep breath, let it out, and then apply a manipulative technique in the direction of rotation. At the same time, I'm not going to let off the pressure. I let it off slowly. I let off the rotation slowly, maintaining the side bending. And then I will reach down and bring her leg back up, bend her knee, and lower it down slowly. Once again, I'll retest dural tests and/or the painful tests in her basic functional examination.